Good evening, everyone. I am Anurag Bhatnagar. I am the Chief of Institutional Business for MediBuddy. I think a lot of interesting sessions we had today, and something which is a cornerstone to the employee well-being within the GCC framework is healthcare, which is what I'll be talking about today. And this is both an employee as well as an employer lens in the GCCs that I'm trying to bring in. So let's start with a small story. This is about Rajiv and Sarah. These are two employees working for a multinational company. Incidentally, they fall sick, and a disease which was common to both of them in different locations, of course. While Sarah walks into care, Rajiv walks into bills. Now, it's not about that, what is the twist? It's not about that the plans, it was about the design of the benefit structure in this company, which led to different outcomes for the two employees working for the same company. And I'm not talking about the IPD or hospitalization here, I'm talking about the OP benefits, which is what I'll delve deeper, which is more of the preventive side of the story. Now, this is one slide which we all understand. Today in this room, there must be HRs from various GCCs. When we talk about group medical claim policies, when we talk about IPDs, you all will have very clear answers, defined structures in your mind that, okay, this is the sum insured that we provide, this is the coverage we give, these are the benefits that we cover, these are the people whom we cover for, these are the limits, sublimits, co-pays, and all that is very well defined. But when we talk about preventive care, I think then we struggle. We say, yes, we have health checks, we also do EAP, but there is no defined structure to it, which is the core issue. You'll be surprised to know 70% of employees are carrying at least one lifestyle disease risk. It could be hypertension, or it could be dyslipidemia, which is cholesterol in the blood. It could be weight gain, and many more factors which they carry today. And interestingly, only 20% of the corporates provide a regular health checkup to the corporate employees. We are taking into consideration all corporates put together, which includes manufacturing, banking, everyone. So, which is more of a reactive approach. We are planning well for the hospitalization, but not planning for preventing hospitalization, which is where the whole story resides. Second is the out-of-pocket expense. Now, this is a very easily available data points. Most of the data points that I'll be presenting today are coming from CII MediBuddy report 2025. In the last slide, I also have a QR code by which you can download in your smartphones, or you can access on the MediBuddy booth as well. But these are researched over 1,000 corporates in the country. And that's how we have come with these data points. 60% of the spends in the healthcare, it includes IPD and OPD both, is out of pocket, which is a large chunk of spend going from an individual's pocket, and these are not coming from the payers or the benefits design teams. And when you are reactive, you don't have a prevention first approach, these are the stats that are coming out very clearly. Since the session is about GCCs and we are talking about them, these are data points I think we all will know. 1,900 GCCs in the country today. It has grown from 1,600 last year, almost 2 million employees. But what is important? Important is healthcare is going to be a very cutting edge for you to retain talent in your companies. And I have data points to support that. With such fast growth of GCCs setting up offices in the country, where will the talent come from? The talent pool pace is not growing this fast, which means we will all compete for talent. And these are a few data points which I want to talk about. The first is about what is an employee preference. This is SHRM survey 2022. After compensation, the second most aspect of the benefits they are keen on is health and wellness benefits. What kind of benefits a corporate is sponsoring? The second is a data point that has come through CII MediBuddy report. On an average, an organization spends or loses 85,000 rupees to 1.12 lakh rupees, either due to stress-related leaves or productivity loss, or chronic conditions leading to productivity dips. Whereas a well-designed wellness program can also give you a 3 to 4 times return on the productivity, which is what we will cover how to design that program. So this is again, what do employee want? We have been talking about this, that okay, employee prefer health and wellness benefits as the second most priority. This research came out with 3 top things, and I'd like to thank Dr. Jayanti, who did mention 2 out of those: flexibility, work-life balance, and mental well-being. I think work-life balance and mental well-being is what she also covered in her previous discussion. These are the top 3 things an employee is looking forward to in their prospective corporate or the organization they want to join. For the first time in this country, if this was the need, we also thought, okay, let's look at how these plans that we have, the preventive wellness plan, how good are they? How effective are they? And MediBuddy came up with this whole scientific exercise. We call it Corporate Wellness Quotient, CWQ. This is what we did for 1,000 corporates, and this is a large gamut of industries. We're talking about IT, ITS, BFSI, we're talking about GCCs, we're talking about manufacturing. The average score in the country today is 55, which means we have a lot we can do still in terms of designing our benefits. A lot of work has to be done. Of course, while 55 is the average, there are IT, ITS companies and services companies who are leading the whole pack. But then there are a lot many who are not able to actually keep the pace with the development that is happening on this front. This is the wellness paradox, which is the time for us to check the efficacies of our benefits that we have been designing. We already discussed that 72% employees want health and wellness benefits. But interestingly, 96% of them want personalized benefit or flexibility, the term I used in the previous slide. Flexibility, personalized benefits. But interestingly, 76% of employees or 77% are not satisfied with the current benefits. The designs or the strategies that we have put in place are not to the liking of employees and could lead to attrition in these corporates. So how can we do that? I think the most important question is, how do we design a very comprehensive healthcare strategy? This is, before going there actually, this is something we should understand, and I think previous panel also covered this briefly. We today, again, look at employees. If we talk about health checks, we say, okay, less than 40 male-female package, more than 40 male-female package. This is how we design our annual health checkup programs. Do we do a differentiation basis, the cohorts in terms of, and this is just one cut. I'm not even talking about demography here. I'm not even talking about socioeconomic background. I'm not even talking about the hazards an employee face. In an organization, they could be factory workers, they could be white-collared workers. The design have to be different. The strategy has to be different. Just this one cut on age bands, look at what the expectations employees have. A 25 to 35 employee want a fast app, a digital app wherein he possibly or she can punch in some data points, get fast outcomes, and maybe a fitness or a gym access is what he or she may prefer. But coming to a 45-year-old employee, he or she may want access to consults, because at this age, I would like to consult various specialists, and maybe a comprehensive health checkup plan which covers a lot of advanced tests. So needs are different, and that's why personalization is important. This is one way we have been working with some of the leading companies in the GCC ecosystem today. We have come up with a flexi wallet approach. Flexi wallet means, this doesn't mean that your spends starts increasing. We all have budgets, we all have designs, and we can't just inflate budgets or spends year on year. But flexi means you can design a benefit plan basis the employee population that you have. You can also include and decide who all to cover in this benefit plan. Like a teleconsultation, possibly you can also cover parental population without having any additional cost. And you have all the specialists available on a tele or a video call. Medicines, you may want to cover only employee spouse, that to a prescribed medicine only, not a OTC medicine, for example. You may want to cover health checks, and then you can have cuts for 35 or 30 or basic other bands that you may want to create. Or you may want to give them a flexibility that if you already know about your health condition, like I am diabetic or I have a cardiac issue, then you should only go and get tested for those kind of packages which are designed for these conditions. So that flexibility can be brought in through a flexi wallet, which means a definite amount is pre-decided and limits, sub-limits are created within this flexi wallet, and you can make it cashless reimbursement to start with and slowly move to a cashless framework. And organizations that have done this, of course, we have seen increased awareness and utilization, wherein one of the goal was to increase utilization. Also, the productivity has improved. And I'll also talk about a tool which is Sherlock 2.0, which has been deployed in terms of checking for FWA, which is fraud, waste, and abuse through a reimbursement mode. This is an organization, a GCC, wherein this is our 4th year of services to this company. This company started with a pure play reimbursement program. A huge amount of FWA started coming up. We all know it's pretty easy to get a medicine bill and submit it for a reimbursement. It's pretty easy to you go to a platform and download any hospital format and you can fill it up. Technology is evolving for sure. With this, a huge amount of fraud was unearthed in the employee population. Of course, there was a lot of attrition which happened in this company. And this company moved towards a pure cashless model. With this cashless model, of course, there was a lot of infrastructure that was created in terms of cashless access for employees. But at the same time, fraud dropped by 80%. When I'm saying fraud, I'm talking about fraud, wastages, and abuse, all three put together. This is 80% drop. The savings that this company got on the outgo was 6.3 crores. Just basis going a cashless mode, deploying a Sherlock system to check for 22 pointers. In the interim, they also had reimbursement for a while, wherein prescription, what name is mentioned, and the bill, what name is mentioned, duplicate bills, alteration with a PDF, a metadata. So the Sherlock also has capability to look at if a PDF file has been altered by somebody through a PDF editor, that can be detected through this tool. This led to a 6.3 crore saving on a policy size of 24, 25 crores. That is huge, just by coming to cashless. See, we all know, if somebody is not well at home, I will rush and take them for a doctor consult. And if doctor says, go get this test done, I will not even think about discounts I want to negotiate. I will just get those tests done. That's what I'll do at best. But when it's cashless, the discounts are pre-applied. You need not to negotiate. You just get them because this is what leading platforms have negotiated on your behalf in advance. New services can be added. These are, I think, hidden gems. I would use the term loosely. We generally focus on health checks, lab investigations, prescribed medicines, consultations. But trust me, numbers are alarming on dental and vision. Those mild headaches that we generally ignore by having a cup of tea or maybe going out for a quick walk and a chat and come back and start doing our work, lives are changing. The digital time that we spend today is huge. Our eyes are not designed for that. 23% of Indians are getting impacted with poor eyesight. And the sad part is many of us are not aware about it. This came as a revelation when we brought vision as cashless. So some of the leading partners like a Lenskart, a Spec Maker, a Vision Express are now onboarded for the first time in the history of the country that they give you a cashless vision service. We did these on-site camps wherein eyes were tested. This was the number coming from that corporate data set, and it's a large corporate. Dental, and we are not used to this. At best, we are used to a preventive health check if somebody nudges us through an app notification or a call. But how many of us go for a preventive dental check, a preventive vision check? I don't think many of us do that. and which is what is causing this whole data set coming out of in front of us. So these are now available on cashless formats. Of course, mental well-being was spoken even earlier, is an important aspect. You have far more evolved platforms today. You have AI-driven platform wherein the person on the app switches the language in the language you want to talk to him or her in, which means if I am talking in English and I move to a Punjabi, they start talking to you in Punjabi. And it could be even a minor of a discussion that you want to have. For example, I have a presentation with my manager. I am slightly stressed. Can you help me? And the person on the app starts talking to you. This is what AI revolution is bringing in into our country as well. So EAP word is changing. It's no more in-person consultation with a psychologist or a psychiatrist for a treatment. Maternity care is a beautiful program. I have been a proponent of this for a decade now. Something we all miss. We always talk about gender equity. We always talk about benefits for a women. But sad part is, except for maybe 30% of forward-looking companies, we still treat maternity as a leave period wherein already spends are done, maternity cover is given. But imagine the journey that women will be leading. It's a life-changing movement for the women. And you can do a lot of support at a very nominal cost. Each pregnancy is different. Each mother, expecting mother needs a care. So a team of gynecologists, physiotherapists, dietitian, psychologists, they act as a supplement to the treating gynecologist. This team doesn't replace a gynecologist, they just support the gynecologist in providing you that kind of interaction, the query resolution time, which a gynecologist may not be able to do, and has given a lot of impact. The return rate to the work have improved. Women resigning after maternity have actually dropped through the program, and we have data points which we can share with all of you. This is a grid coming across industries, 1,000+ corporates. You can very well also, so what this shows is, if in a given industry, what kind of benefit utilization is happening for the programs that you have designed. And if your design, if like in a BFSI, if number of unique employees using a benefit from the programs that have been designed is 11 to 20%, it's a moderate performance. There are gold standards. There are corporates who are actually achieving and overachieving these numbers. Basis, of course, a lot of planning, designing of the plan, and awareness program that has to come alongside it. And this is how some of the corporates have reached gold standard as well. This is what I had to cover today with all of you. This is the report I was talking about. This is the second version of CII, Confederation of Indian Industry, MediBuddy report 2025. This is across 1,000 corporates. A lot of detailed aspects of healthcare and evolving face of healthcare has been covered in this report. You can scan this QR code and also visit on our booth if you have any further queries.